My name is Sanjay Gupta. I'm a cardiologist in York, and today I thought I would talk about a subject called angina. Now, angina is really common. A lot of people take medicines for angina, and very few people really understand what angina is. So, angina refers to chest discomfort which is being caused by a lack of blood to the heart. Okay. Now, it is a symptom. That's the first thing to say. Angina is a symptom. Uh, you know, you don't go to your doctor um, with something, and you have to have the symptom. Angina is the description of a symptom. It's not necessarily a diagnosis someone can give you without the symptoms, if that makes any sense. So people say, well, do I or do I not have angina? And I say, well, if you have chest discomfort, which is caused by exertion and gets better with rest, then that's angina, and that needs investigating. Okay. So the way to try and understand this, the way to try and understand what angina is to think of the heart as well. Think of the road system, for example, in the UK. Okay, we have motorways, which are very big roads, and then the motorways lead to A roads, and then B roads, and then C roads, and then you have the little side streets, and eventually you have your destination. So if traffic does not get to its destination, then the destination screams out, and that screaming is angina. Okay, so if blood is not getting through to its destination, then the destination, or the muscle which needs the blood, will scream out, and that will manifest as a discomfort in the chest. And usually the time when you notice this discomfort the most is at times of exertion, i.e., if the traffic is not getting to its destination, it is more likely that this will happen at times of peak rush, at the peak rush hours, i.e., when the heart is stressed, when the heart wants a lot more blood, that's when the blood won't get through. So the whole point of angina is it's a discomfort which comes on exertion, when the heart is asking for more blood, but the blood simply can't get through. And the reason the blood can't get through is usually because if you have, for example, roadworks on your motorway, or if there's a jam, if there's roadworks on the motorway, then whilst at off-peak hours, for example, the traffic can get through the roadworks to the destination. At peak hours, the traffic will not be able to get through the roadworks to its destination quick enough. And so angina is a symptom of discomfort in the chest, and it doesn't have to be a pain. It is usually a discomfort or a heaviness or a squeezing discomfort, which comes on exertion and goes away with rest. A lot of people say to me, well, I get pain all the time. I get pain in my left arm. I'm getting a pain in my left arm. It's there all the time. It's been there for 2 or 3 days. Have I got angina? And I say, no, angina is a discomfort that is brought on by physical exertion and gets better with rest. It's highly unlikely that you would have discomfort in your arm or on your chest at rest, which does not get worse on exertion. It has to get worse on exertion. So if you're getting discomfort at rest, but you're okay exercising and you're okay doing everything else, then that can't possibly be angina. It has to get worse on exertion, i.e., if you have roadworks and the traffic is not getting through the roadworks at off-peak hours, then it surely has to be even worse at rush hour. And So there are other ways of getting angina. You don't necessarily have to just have a problem with the you don't necessarily have to have roadworks in the motorways or the A roads stopping the traffic from getting to its destination. If you have a shortage of traffic to start off with, i.e., if you don't have any blood in your body, then you may have clear motorways, clear A roads, clear B roads, but still not enough traffic will get to its destination. That happens in people who have anemia, for example. If you don't have enough blood in your body, then it doesn't really matter if you have no narrowings in the heart arteries. There still won't be enough blood and therefore oxygen getting to the heart, and therefore the heart will scream out and people will get angina. So the first thing I always do when someone comes and complains of discomfort in their chest, which is brought on by physical exertion, I check their blood count to make sure that they're not anemic, because that would be an easy thing to try and treat. Then you have to say to yourself, okay, can you have a normal blood count and no roadworks and still get angina? And the answer to that is yes, you can. Now, if your heart is beating excessively fast, okay, it's beating faster than it is designed to beat. So people with heart rhythm disturbances, where the heart can race up to 200 beats per minute, the heart is not designed to do that. You know, that's not the way the body function was designed. So when the heart is doing a lot more than it needs to, you may have enough blood, you may not necessarily have a problem in your heart arteries, but there may still be a shortage of blood for the amount that the heart is doing. Okay, and that can also cause chest discomfort. So some people who have palpitations and their heart's going very fast at 170, 180 beats per minute can complain of discomfort in the chest. And that doesn't necessarily mean that they have a heart artery narrowing. Of course, if you have discomfort in the chest, then that's not good, because it's telling you that the heart wants blood and the heart's not getting blood. And if it doesn't get blood for a long time, then obviously you could cause some damage to it. But usually it's not the bad kind of problem that we normally associate with angina, i.e., massive roadworks, massive narrowings in the heart artery, stopping the blood from getting through. One other thing to bear in mind is that how do you investigate angina? Well, there are two things, okay? One, you can simulate rush hour, okay? So you can take someone who's complaining of chest discomfort on exertion and put them on the treadmill and make them work really hard. And if you find that the patient starts complaining of discomfort on the treadmill, or we see any ECG changes at that time, then we confirm that they have angina due to heart artery narrowings. That is one way. The other way is to send a helicopter and actually look at the motorways and the A roads and see if there are major roadworks going on. That's called an angiogram, where we actually look into the arteries and see whether there are any narrowings. The problem with that is that doesn't necessarily tell you whether it's not. See, the problem with doing an angiogram, because some people have an angiogram and the angiogram comes out normal, but they're still getting chest discomfort on exertion, and they say, well, how can that be? My angiogram is normal, but I'm still getting chest discomfort on exertion. And the answer is that the angiogram, the test that they do by putting dye into the heart, only looks at the motorways and the A roads and maybe the B roads. It doesn't have enough resolution to look at the C roads. It doesn't have any resolution to look at the little side streets. And so although your motorways and A roads and B roads may look okay, you may still have roadworks going on in the side streets or on the C roads, and therefore you will still have a shortage of traffic to its destination, and the destination will still scream out. And when the destination screams out, you still get discomfort. Discomfort is discomfort. But the advantage, the nice thing about having an angiogram which doesn't show any significant narrowing in the motorways, A roads or B roads, is that that tells you if you had a problem on the motorway, for example, a large part of the destination, a large part of the country, so to speak, would not get traffic. And therefore, there's a large part of the heart that is at risk of being damaged. If it's only a little side street or a C road where the problem is, although you don't see it on the angiogram, it can still cause pain on exertion. But if it were to block off completely, then only a very small part of the destination doesn't get its traffic, i.e. only a very small part of the heart would be damaged, and therefore it is highly unlikely that that would be life-threatening. And so then you have to say to yourself, well, okay, what is the why does it happen? Why do these roadworks happen? And truthfully, the main reason is inflammation and aging. So if you have old roads, you're more likely to require there's more likelihood that there'll be roadworks on the road. The older the road, the more roadworks. The older your arteries, the more likely you will have narrowings. Number two, if the roads are in need or have not been looked after for several years, and they're in a state of, they're requiring repair, then there's more likelihood that those are not going to be in a good enough condition, and there's more likelihood that there will be roadworks or problems or potholes on the motorway. So if you have had a bad lifestyle where you're smoking, where you're eating bad food, where you're not exercising, where you're undergoing through stress, then you're more likely to have roadworks. Sometimes it can just be, bad luck where, something falls on the road and therefore stops traffic from getting through. And that is essentially genetics or bad luck. Some people just have bad luck where their heart arteries start getting narrow, even though they may be doing everything right. And if you have bad genetics, then that can do it as well. So there are two ways in which traffic may not get to its destination. Number one, you have bad roadworks, which are gradually getting worse and worse over a period of time, and therefore the traffic struggles to get through. And therefore, in those people, the person walks, he gets the discomfort, he stops, the discomfort goes away. He doesn't do anything about it. This continues 3 months, it can continue for weeks or months, but what happens is that it is progressive. So that the person finds that his exercise capacity gets less and less, i.e. he could walk half a mile and then get the discomfort. If he doesn't do anything about it, he will walk a quarter of a mile and then get the discomfort. So in that, what is happening is there's gradual increased roadworks, there's less and less traffic able to get through those. And two things happen, okay? The first is that generally the patient will go and seek help because they're continuing to get these symptoms on exertion. But the other interesting thing is that the traffic will start finding its own way to bypass the area where you have this. So the longer you have these roadworks, the more likely it is that the traffic will automatically start going down little side streets and find its way to the destination. And when that happens, that is called collateralization, i.e. collaterals form, blood vessels form to try and naturally bypass this narrowing. So that's why a lot of people may never have had a heart attack, but are found to have a blocked vessel. And then the doctor says to them, yes, you've got a blocked vessel, but there's no need to do anything about it because you've formed these things called collaterals. That happens when you have a long-standing narrowing, which is just gradually getting worse and worse and worse. Then there is another type of thing that can stop traffic from getting to its destination, and that can be just a sudden, so you may have a little bit of a narrowing, which is unexpected, and then there's a sudden car crash. And when that happens, everything jams, and it happens within a matter of seconds. And those are the people who have the sudden heart attacks. When a car crash is going to happen, you can never tell. There's no way of predicting it, but you do know that it's more likely to happen if there are general roadworks around. But the roadworks don't have to be so bad that they're obstructing flow all the time, but even a little bit of minor roadworks or pothole or something like that, and can suddenly destabilize the traffic, and the traffic comes to a standstill, and that's an acute heart attack. What else can I tell you about angina? So when that happens, when the second thing happens, that's a heart attack. That's an unstable, it's called unstable angina. When you have progressive, slow progression, then that's called stable angina. And most of the treatment is designed to do one of two things. It's either designed to open up another lane on the motorway or on the A road. So the spray that doctors give patients, the GTN spray, what it does is transiently opens another lane on the motorway or on the A road, allowing traffic through. But it does so only transiently. So you take it, everything opens up for a little while, and then it closes back. But it's enough to allow traffic through. And as it does so, the discomfort improves in the patient. Of course, you can have tablets that last the whole day. And those are things like calcium antagonists or isosorbide mononitrate or imdio nitrates, oral nitrates. They do the same thing. The other treatment is really designed at slowing the traffic down. So it's like putting signs up on the motorway saying you can't go very fast. And if you slow the traffic down, then that allows the traffic through the narrowing. So you don't get that sudden holdup, which comes from fast traffic going through. And those are things like beta blockers, all right? Finally, it's worth knowing that, yes, you can put you can do something called stenting, where you can temporarily repair the roadworks, and that will allow the traffic through. So improves the symptoms of discomfort and exertion. However, it's important to know that the stenting is only done where the roadworks are the worst, where the holdup is the worst. But if you have other areas of disrepair on the roads, then you can still have more problems as time progresses. So having a stent put in is not a cure. It's simply simply easing your symptoms. It doesn't take away the fact that you may have bad roads. Okay, and if you have bad roads, they can always misbehave. Similarly, people often say, a bypass, once I've had a bypass, I'll be fine. Well, the bypass is, again, you're only bypassing the bit which is the worst hit area. If you don't have a significant holdup of traffic, then there's no reason why the traffic will go down the bypass. It'll still continue to go through the easiest way, through the way it was, so if you have a motorway which has only a little bit of roadworks, but actually the roadworks aren't bad enough to be stopping the traffic from going through, then there's no point bypassing that area, because traffic will still continue to go through that area. And that is why bypasses are only done around the areas which are the narrowest, or where there's the most disrepair, or roadworks where there's the greatest holdup. The rest of the motorway still stays, it's still your own. So if you have other areas of disrepair, if they're not holding the traffic up, they're not going to be bypassed, but they could still get worse even after your bypass. And that's why a lot of people who have had bypasses or stents come back later on, particularly if they haven't looked after their lifestyle, with more angina. So that's just a little bit about angina. And the reason I brought this up is simply because I get a ton of people who don't really understand angina and who are taking all these medications for angina. And once you understand what angina is, it makes a lot more sense. And you know why you're taking your tablets. And if you know why you're taking your tablets, then at least you feel more comfortable taking your tablets. And you can work on all the other things that can help reduce angina. One of the things that's quite good is magnesium, again, for this kind of thing, but not commonly recommended, just because no one's done much research on it. Anyway, so I hope this was helpful. I'm sorry this was a little bit disjointed, but my name's Sanjay Gupta. I'm a cardiologist. This is my website. This is my Facebook page. And this is how you can contact me through Jeanette. If you found this useful, or if you know someone who has angina, please feel free to share it with them. Thanks. All right, bye.